Just about every patient who's on a medication has some titration or removal. I think people really like supplements, and the way that the supplement industry has been going, it has high promises. And sometimes we just have to learn what our body does on simple, single, whole ingredient foods. Patients feel so much better also. So they kind of get antsy that they want to see their next lab results within, a couple weeks. When do we get to do labs again? When do we get to see how this is going?
Welcome, everybody. Today we have with us Christa Povec, who is one of the first folks we've hired at Revero, and very proud to have said that we got you, and we're lucky to have you. So anyway, Christa, you are, I think you were the first coach we had, and you kind of led that program for a while. Now you helped with the enrollment for a period of time. And
I did.
Let's talk about who you are, first of all. Let's just get that out of the way. Who is Christa Povec? What do you, what sort of created you, I guess, if that makes sense.
I grew up in California, lived in Reno, Nevada for a number of years. Got 2 kids. They're 24 and 20. Moved out to Texas, and it was all because of a man. So we moved out here, bought some property. We've got some Angus cows and a pair of mini donkeys and our dogs. Our kids are still in Reno. They're at university and graduated now and doing the adult thing. So they're not interested in Texas quite yet, but fingers crossed for someday that they'll come out here. But I just love it out here. It's probably the favorite place I've lived. And you spent some time in Texas.
I spent the largest part of my life in Texas. Yeah, I spent about over 20 years. Yeah, for a long time. Yeah,
I like it a lot.
Now you're what, near Austin? Are you in Austin or near Austin? I think, right?
Not in Austin proper, in the outskirts, in the country.
Mm-hmm. Okay.
Yeah, we enjoy it out here. It's nice and quiet. You can go into Austin and feel the crazy hustle bustle, or you can come sit home and do some porch sitting and watch your cows.
I aspire one day to have cows. That would give me comfort in a time of you don't know where your food's coming from.
Well, exactly. It's been very rewarding to harvest, to watch them breed and treat them well and give them respect and plenty of good grass. And there's nothing like having a freezer full of meat, for sure, especially when you grew it yourself and you know where it came from.
That's awesome. So how did you get interested in health, I guess? Let's talk about that.
Yeah, so I grew up in an Italian and Greek family. Everything was surrounding food, and make sure you eat your whole plate because mom made it, and everything was celebrated with food. I just realized as I was getting older, probably before college, I started having just some eating issues, like eating dysfunction, I guess you'd call it. But in my family, we never focused on fitness. So I knew I wanted to be healthy. I knew I was going to start a family, and I wanted to give my kids a good foundation for how to nourish their body and how to fuel themselves. And I honestly didn't know the first thing except for eat everything on your plate. So I started educating myself. I got certified, and I started doing some marathons and running a lot, and quickly figured out that cortisol was an issue when you do too much of that. I was kind of eating a bodybuilder style diet, and I'm not sure that eating 6 times a day was a good fit, at least for me. So started studying low carb and carb cycling and ways to manipulate carbs in your diet. And I got really interested in bodybuilding. Actually, Bill Phillips, I don't know if you've ever followed him, a long time ago when he had the Body for Life program. That's what got me interested in the fitness portion.
Yeah, I remember he had some interesting transformations as part of his thing. He showed some.
He did. Yeah. And it's funny, everybody got tan too. Did you ever notice that? His afters? He had some great success with people. Yeah. I think once all that kind of fit together and I started raising my kids and I was looking for extra income, I started doing my own fat loss coaching, training, health coaching, that sort of thing. And it was always sort of a side burner thing. Until I heard about Revero, and I thought, what a great idea to be a part of something new and something big, and being able to funnel patients through a metabolic and autoimmune transformation protocol that's already written, and I can bring in my own experience, and I think I could help the most people that way. So I slowed down my own business and jumped on in.
So obviously you've got a background in athleticism, sports, marathons, bodybuilding stuff. I mean, you've taken care of your own health, I think, fairly effectively through the years. I know you are someone that consumes a lot of meat, if I'm not mistaken. I think that's fair to say, as do I. How has because it's interesting because I don't. There's not a lot of places where you can combine both a someone who has sort of the practical day-to-day knowledge in the form of like health coaching and things like that with a clinical team that actually sort of promotes that. I mean, there's some physicians out there that kind of get it, but then they don't have any resources to help their patients with. And then also there's a lot of people that are on the sort of the on the ground coaching side that don't have a lot of support from the physicians in the world.
Right.
And this is the first time we've really kind of married that in a big way. How has been that experience for you, been having backup from a clinical side, I
Oh,
suppose?
it's amazing. They've been so supportive. I think we all work really well together. And in our chat feature, which is the main form of communication with Revero, having access to your coach and having access to your provider from the patient standpoint, they love it. They've got two people weighing in with their areas of expertise. And oftentimes, sometimes I'll even kind of ping the provider and say, this might come with a little more weight if you jump on into the chat and corroborate kind of what I'm saying. Sometimes from the health coach perspective, patients hear it better, and sometimes from the provider perspective, they hear it better. So it really just depends on what they're looking for. But it's so nice when the provider can jump in and give you support or help out with, something the patient's going through, maybe give you another point of view on something. And I think the providers learn from us health coaches as well. So it really just benefits the patient in the long run.
Yeah, I mean, amen to that. I mean, I think as a physician, you're trained in certain areas, and honestly, nutrition, eating, lifestyle is not really one of them. I mean, at least from the allopathic standpoint, where most people, interact with physicians, and I think the ability to see kind of real time changes, which is what you don't typically see as a physician, because you see things maybe long term, 3 months, 6 months, yearly visits or something like that. But to see
Yeah.
stuff that takes place over a period of even days and weeks is a little bit different. And so,
It's
how,
awesome. You can catch things in real time when you're working with patients who are in the chat. They can say, "Hey, I'm feeling this," or "I'm doing this," where in a traditional setting, the provider's going for 3 to 6 months, like you say, and just doing the follow-up basically on the meds, because any lifestyle changes kind of need a daily or weekly update to titrate how things are going.
yeah, that is something that I've seen a lot of. Even the provider, because I've talked to a lot of our providers, and one of the things they're really excited about is they said yes, they really appreciate the ability to get this sort of real time feedback, this frequent updates, so you can see, because if somebody comes into the office on one day and they happen to be feeling good or happen to be feeling bad, or their lab looks good or looks bad on that day, a decision is made based on that tiny amount of information. Whereas now you have a massive amount of information that really shows what's really going on a time. And I think that helps. I was just reviewing our white paper on the efficacy of our first, nearly 1,000 patients, and it's pretty impressive what we've been able to accomplish up to this point.
I
What
don't
we've been
doubt
able
it.
to
I
do.
haven't seen that yet. Can you enlighten? Can you bring anything up yet, or is it not quite published?
Well, I don't. We're going to publish it in a way, and it's not the final version isn't out, so I don't want to.
Okay,
Because it was my feedback. They were like, read this and see what your feedback. And I had some feedback on how they should order things, and so on and so forth. But
fantastic.
so once the final version is out, I think we'll be able to we'll actually share it publicly for people that are interested. And then of course we have another funding round coming up. So for potential investors, as they want to see what we're able to accomplish, I think it's pretty cool to see that.
Fantastic.
As far as your interaction with, because obviously whenever you involve human beings in a situation, which we always have, in healthcare, has always been humans treating other humans. There's a sort of a personality, a personal style, I should say. What has been your approach to helping people get healthy? I mean, I know how, like, some people just have different some people have different needs to improve. And
Yes.
do you find that what works for one may not work for everyone, and how do you make those adjustments? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Yeah, I'm actually pretty direct. I'm pretty straightforward. I can tell through chat if a patient needs a little more explanation or a little more deep dive into the emotional part of how changes may make them feel or how it will fit in their day, or if it's going to be a difficult change or the tweaks we're suggesting are not a good fit quite yet. Maybe we have to take a couple steps back. But I've also had patients who say, I really do appreciate your getting down to business mentality and tell me exactly what I need to do because that's what I need to hear. So I wouldn't say it's harsh, but it's definitely, A to B. Give you the information you need. And if we need to dial back a little bit, we can kind of maybe stretch out a couple of those things over the next few weeks.
And as far as, who are you seeing typically as our patients? I mean, are you seeing a lot of autoimmune conditions? Are you seeing mostly metabolic conditions, obesity? What are you mostly seeing?
Lately, I've seen a lot of hypertension, diabetes, and overweight or obese. I had kind of a random patient a few months back. He was a CrossFitter, but he had pre-diabetes, and he also wanted to talk to someone about getting fat adapted and entering into his CrossFit competitions. So that was really fun for me to do. But then the rest of the patients are similar in that it's mainly metabolic. I've got a few autoimmune with some psoriatic arthritis or some rheumatoid or things like that. And it's just so rewarding, regardless of what type of patient. I wouldn't say I specialize in anything or have a favorite type. It's just so fun to see what changes can come so fast. And I think patients feel so much better also. So they kind of get antsy that they want to see their next lab results within, a couple of weeks. When do we get to do labs again? When do we get to see how this is going? And it's exciting. The whole thing is very exciting. And like we said before, in real time, getting to see patients feeling better is really a lot of fun.
Yeah, it is interesting to see how sometimes it can happen very quickly, particularly people that are coming from a lifestyle of just poor habits in general, and that where you really see the real big dramatic changes. Of course, we have some people that have already sort of somewhat dialed it in, and then they utilize us to sort of really make those final changes that need to be made.
Yeah.
Do you find that how different of an approach do you see for some? I mean, do you see that one person, what works for one person somebody else might need a radically different approach? Have you seen much with that?
I see so many different types of patients. Sometimes patients come to us from a typical diet, and really just the first few things that you show them how to do will make the biggest difference. And I see some patients who come to us on complete carnivore and they think they've done all they can do, and then you give them a couple of tweaks and that's the 5% that makes the difference. So, I mean, I just had a patient who came to us carnivore. He was including coffee, but he was also including flavored electrolytes, and he was dealing with prediabetes and hypertension. And he had pretty much met his weight goals. I think he had a few pounds he could like to lose, but that wasn't really the main driver. I suggested, what would you think if you still want to make some changes in your blood pressure and blood glucose if we take out the electrolytes? He's like, well, that's not it. It's, this is there's zero carb and there's no calories, and that couldn't possibly be it. Well, he agreed finally to give me 2 weeks of no flavored electrolytes, and darn it if his markers did not completely change. So sometimes, some of those powdered, flavored, multi-ingredient things can really make a lot of difference in your hormone profile and how your body's responding.
Yeah, it is interesting how sometimes these very small changes can make a difference. I know it's like for me, I'm right now I'm on this 100% beef diet, and and what compared to was a diet that had mostly beef but a little bit of eggs and dairy,
Yeah.
and removing the eggs and dairy for me has made a huge difference recently. I mean, it's not like I was sick, but I feel just quite a bit better, which is kind of
Well,
kind
it's
of
such a
cool.
slow on ramp. I mean, when you start including little things here and there, it's such a slow change in how you feel. You really don't notice it until you completely wipe them out. And I think that's what a lot of patients really aren't excited to do is give up the dairy or give up the eggs or whatever. But once they try it, there's always feedback of, oh man, I do feel much better. I do sleep better. I do have a little more energy. My joints don't ache or whatever it is. Even when I start including dairy here and there, I'll let it slip in and I'll catch myself because I know there's sort of a threshold there. You're like, okay, maybe let's take this back out. Let's see if we feel better. And all the time it works.
When you mentioned that we have a number of, our clinical team has developed a whole bunch of protocols for each particular medical condition that we follow. And it's a lot of it is nutrition, of course, but I mean, obviously, I correct me if I'm wrong, but you also have an appreciation for other aspects of lifestyle, whether it would be physical activity, exercise, sleep, and so on and so forth. Does that make it into your interaction with your patients? Do you talk about some of these other things?
I do. Sleep's a big one. Um, and I do a lot of coaching on circadian rhythm management and having a bedtime routine and things like that. That makes a big difference, in addition to the electrolytes that we suggest. For some patients, it's a lot of stress management, and they're just running, running, running. And I really like to coach on taking some time to yourself. And really, I've got one patient who she's a foster mom, and she has kids around her all the time, and she never takes time for herself. And I don't think she realizes the impact that can have to just have 10 minutes of, clearing your brain and nothingness and having some downtime. And she's figuring out that when she doesn't make some downtime or some stress management time or some fill her cup kind of time, that she grabs for snacks or she goes off track or so we just kind of put that correlation together. So yeah, stress management, fitness, walking, fitness and exercise is not part of the Revero protocol, but I do have patients who I have given them information on how to start moving, weight training, walking. I always suggest a trainer so they don't do anything that's, not a good fit for their body. And people always feel better when they include some kind of movement.
Yeah, for sure. You're obviously preaching to the choir in me. I'm a huge proponent of activity and exercise, and one of the first things I talk to people about is, hey, diet can get you so far,
Mm-hmm.
but not being sedentary is also quite helpful, and as is sleep. I think those are some of the most important things we talk about. What as far as what are you typically seeing from like demographically? Are you seeing mostly women? Are you seeing mostly older folks? What would you say that the typical referral patient has looked like, at least in your experience so far?
Yeah, it's interesting. I don't know what creates the waves in demographics, but when I first started a couple years ago, it was lots of women, and then it was kind of a lot of men. And then it was now I feel like it's sort of 50-50. If I look at my patient base, they're men and women, maybe 60% women, 40% men, maybe 40 to 70, somewhere around there. People, it's a lot of people dealing with metabolic and autoimmune issues, and that's not typically a younger person yet. So, and it's a lot of your followers because you talk a lot about Revero. It will be interesting to see how that changes when we start opening Revero up to a different type of customer. If we start, moving into people who don't hear your podcast in different ways. Yeah, I think for now it's like 60-40 women, men. And
Yeah.
for some reason lately it's been a lot more metabolic than autoimmune, but we've had all kinds. I had a lady who was on service with us for a year, and we didn't admit her for migraines, but she had migraines. We admitted her for IBS. But her migraines went away. Can you imagine? Pretty cool. Her migraines, and then she was also dealing with some fertility issues, and we weren't treating that either. But she did give me an update that she feels like she can try to get pregnant now. So it's just very rewarding, all the things you hear from people.
Yeah, it is interesting because we have a range of things that we said we're going to treat initially, and yet as a side effect of our treatment, a lot of other things get better that aren't like officially being treated by us, but we see that. We see it with mental health as well.
Yeah.
And my hope is, we are able to expand our primary scope to we can say, hey, we can take somebody with a primary diagnosis of hypothyroidism or infertility or something like that, and do that as time goes by, because I think we'll be effective at that. But right now, like I said, we rolled out with a not a super narrow scope, but a fairly broad scope. But we still, we have a sort of thing, and so it's metabolic issues, which include things like diabetes and hypertension and obesity and all which is a very, very common presentation, and often people that have other things have that. So a lot of people can get in if they're just overweight. It's like, okay, you're
Right.
overweight, we can take care
For
of you.
sure. Yeah, there's a handful of people with no diagnosis besides their weight management.
Yeah, for sure. And are you seeing? Well, let me ask you this: are you seeing any patients that currently are on or were on some of these weight loss drugs and new drugs, the GLP-1s? Is that something? Because I think we have a few patients in the program that either were on them or started on them. I don't think we typically start people on those, but I mean, we've had a few of those folks. Have you had any of those folks in your?
I've had a few, and they've come through and improved their eating program and have since graduated. I also have patients who have been through bariatric surgery and have some absorption issues. So we're really working on that whole food, high bioavailability kind of diet and trying to make them feel better. There are patients who are kind of wavering, like, should I go on the GLP-1s or should I just try nutrition management? And I always go back to, your body goes into that GLP-1 cascade when you eat low carb and high animal-based foods. So let's try this first so that you don't have to worry about any side effects or extra expenses or managing an additional medication. And it's been it's been really rewarding. I've never seen anyone start a GLP-1 while they're doing our program. It's just effective enough if you follow the guidelines and allow your healthcare team to make tweaks with you along the way.
Yeah, it's interesting because if you look at the long-term data on the GLP-1s, the majority of people end up quitting them anyways. Like something like 80% end up quitting them because they can't handle the side effects or the cost. And then when they quit, most of them will gain most of their weight back, and then also a lot of them will have lost a lot of muscle. So now you've kind of lost a bunch of muscle. You put on all the fat back on 2 years later, 2 or 3 years later, and then you're kind of in a worse position. So I mean, ultimately, you still have to. There's the short answer is there's no real shortcuts. I mean, you still are going to have to deal with food addiction and lifestyle issues one way or the other. It might give you a short temporary reprieve, and for some people it might kickstart things, but for the majority of the people, that's what happens. And so,
well, that's my main concern is muscle loss, especially with what seems to be our demographic lately. Muscle loss in people over 50 is it just makes it that much harder to get back. And yeah, you're right. Why would you want to put your metabolic profile in that dire of straits when you can eventually get there if you just adhere to, a low carb or carnivore program?
Yeah, I mean, I think some people see it as, well, it's a shortcut and it'll help me get quicker, and they don't. And it's like it can be frustrating to say, hey, this is going to take me a year or two, whereas I might be able to get a more rapid response in a few months. But then again, what happens 2 years down the road if you just put yourself in a worse spot? So it's kind of interesting with that.
Yeah, why not learn how to do it right now?
Yeah, let's talk about like some of the autoimmune stuff you'd mentioned. Psoriasis, rheumatoid arthritis. What kind of things have you seen over time?
It usually, for like rheumatoid or arthritis or inflammatory, it usually takes sometimes the first week, patient notices a little bit of relief, and then into the second week, they notice a little bit more relief. And I think it's just enough to keep them going. I know complete remission takes a while, 6 months, a year, maybe, but the early feedback is very encouraging. And it almost gets to a point where, they're 3 to 4 months in and they haven't noticed too much more, but having a conversation about, look, it took you a while to get here and let's just be a little more patient before we start adding things in that could flare things back up. But they're always very impressed with the pain relief that they get early on. But I think complete remission still takes, it's got a little bit of a runway.
So let me ask you about this particular demographic, because I always get a lot of people in this group that are struggle. And this is your perimenopausal woman, woman maybe in their early 50s, mid 50s, whatever, where menopause has wrecked. It's caused different things to happen to them, and they sometimes struggle with weight loss. Are you seeing that population very much, and anything you find that seems to be more effective for that group?
Yeah, absolutely. And I think there's just so much conflicting information out there that it makes it difficult to, you really have to hear these people out and hear what they've tried already before you make some suggestions. For some people, a high fat plan really, really is helpful. In my experience so far, that perimenopausal or menopausal women, I don't know if they always need high fat. So we just talked about this on our coaching call a week ago, because it seems like patients also it depends on the patient, and you have to trial and error, and that's the frustrating part. But sometimes the lower fat is more helpful for some people. And so I've seen a lot of response from, having a couple leaner protein days coupled with some good maintenance fat days. And it just takes a while to calibrate. But, if they're willing to listen to their healthcare team and try to implement a few things, it can really just start taking off. But I don't think those are things that people think of on their own, because there are so many influencers out there talking about eating a stick of butter with their steak and eating fat between meals. And sometimes people don't need all that.
Yeah, it is good to point out. I do think a high fat approach can be very beneficial for certain indications, but then again, for other indications, it's less effective and sometimes detrimental for people. So we have to kind of realize that. Have you seen, our company is not a strict carnivore company. Mm-hmm. For people that are wondering that. I mean, we do utilize it, and I probably see some of your patients do utilize it. But when we use another approach, say a low carb ketogenic approach or something similar, paleo approach or something like that, are you finding that you sometimes have to pull some of those foods out? What are the common culprits of foods that you end up saying, hey, let's remove this for a while?
Usually it's dairy, and that's also the one I get the biggest fight on. It's either dairy or people who like to supplement with a protein shake. There's a lot of people, their first question is when they see their protein goal, they say, well, can I use shakes? And my answer is always, well, that's a processed food. And so let's learn how to eat the whole foods and then maybe eventually bring them back in. But I like to use it's not part of the Revero program, but my imagery is a stoplight ranking system. You've got your red foods and your yellow foods and your green foods, and the whole ingredient foods are in the green part of the stoplight, and the yellow foods would be more like maybe some dairy, maybe some whey protein or some supplements. But the Revero program uses yes foods and limited foods and no foods. And so when I'm on a welcome call with a patient and they say, well, what about dairy? I have them go to their app and look in their app and see that they can actually see their own food lists. And I say, well, where does dairy fall? Is it limited or no, or is it yes? And for most people, it's no, at least while they're getting started, and we can always reintroduce it. And then, the protein shakes is the other one. I think people really like supplements, and the way that the supplement industry has been going, it has high promises. And sometimes we just have to learn what our body does on simple, single, whole ingredient foods.
Yeah, it's interesting because, you said these people have individualized food lists based on, their demographic information they loaded based on their health conditions. So it's not everybody's in the same program. There's sort of differences and nuances there. And it's interesting. You probably kind of get a sense of time, because after you see lots and lots of patients come through, you're starting to see these are commonalities where I see these patients that struggle with this issue, with this particular food. Is that fair to say that you start seeing these patterns emerge?
For sure. Yeah. If I've got somebody, they're seeing us for ulcerative colitis or IBS or Crohn's or something, I can pretty much guarantee dairy is going to be in the no column. Or um, let's see, people who, well, any inflammatory, actually, dairy is usually never in the yes column for anything inflammatory. Um, there's some patients who have come to us already on carnivore, and we don't move them into the low carb space. We don't reintroduce vegetables and any carbohydrate or plant matter for those guys. But when you come in first to Revero and you're straight out of the, what would you call that? Straight out of the entry bank, it's always low carb. And so looking at if they've got diabetes or hypertension, sometimes people start with, dairy in the limited, and then we just try it. And then if they stop making progress, it's usually the dairy that we can titrate and toggle. Yeah. Either that, or on a whole separate note, it's the flavored BCAAs or the flavored electrolytes and I don't think we talk about that enough. There's been a number of patients lately who make great progress, then they get to a certain point and then they get frustrated and they're like, why am I not losing more weight? Why am I not changing my glucose yet? And I just have to ask, are you taking any flavored supplements? Because those are all processed, chemicals. Well, yeah, but that's not it. I mean, I kind of already brought up the one patient who said, that's just zero carb. There's nothing to worry about. But a lot of times that will make a big difference, just removing those. In fact, did you see the latest study from the University of Copenhagen? It just came out a week ago about ultra-processed foods.
I think so. I probably have, but remind me, because there's been a couple that have come out in the recent times. But
yeah, it was just really interesting. It was a group of 43 men, younger men, 20 to 35, and they did a washout crossover study. So they had the same amount of calories in these two groups of men. One was whole food and one was ultra-processed food for 3 weeks. And then they did kind of a washout where they let them go back to their regularly scheduled nutrition plan. And then they switched the two groups and had each one eat the opposite amount of type of food, ultra-processed or whole food. And it was a 3-week period. And the men who ate the ultra-processed food with the same amount of calories gained 2+ pounds over that 3 weeks. And so it's really not always just a calorie counting game. They had a lot of hormonal disruption. They had decreased testosterone, decreased FSH, and decreased CV markers like glucose and insulin. So I've actually sent that study to a couple patients who were kind of giving me pushback on some of these processed supplements that they think were doing them some good, and just, gently ask them for a couple of days without them and see if they feel a little better.
Yeah, I mean, there's obviously a push to remove or sort of, I would say, put ultra-processed food in the category we shouldn't be consuming much or any of it. And there's people that are pushing back with that, saying, well, how do you define a ultra-processed food, and what are the ingredients? And there's maybe some more nuance in that. But for sure, at the end of the day, if it works, it works. Or if it doesn't work, it doesn't work. And then this is a nice thing you can try and you can object, because you guys are tracking some level of biomarker type information on a daily basis. So you can kind of see, you can see it, displayed on a graph. It's like, look, this is what's happening, and this is what happens when you change it. So it's kind of a nice way to kind of solve some of these subtle problems that may say what people would otherwise never, they would never, and this is the important thing, they would never solve themselves. One, because they're emotionally attached to these things, and you come in there with sort of this objectivity and say, look, this is what the data is showing. This is what your own data is showing.
Exactly.
Let's make the change here, because when you're emotionally attached to something, you really like something, you're like, well, it can't be that. No, it can't be that. I don't want it to be that. And maybe it is. And then you go to,
when they're just starting out too, it's super helpful to see those metrics, because you can see, are their cravings high? Is their hunger high? Is their mood low? Is their sleep poor? And you can sort of just get a good picture of, hey, you were doing kind of stable, and then all of a sudden you had all your markers changing. What happened? Oh, I went to a barbecue and I went off track and I slept poorly and I ate something I shouldn't have. And okay, well, now we can see where that happens. And sometimes I'm connecting the dots for them, because they really don't even notice it's happening, but they're just logging every day.
Yeah, I was going to say, you start to see patterns after seeing, lots and lots of patients come through and looking at their markers and their responses to different events, and you can say, hey, look, this is predictable in many cases for some.
Yeah.
Now you mentioned, coaching calls, so you guys are sort of coming together on a regular basis among the different coaches and saying, hey, what are you seeing, what are you observing, and learning, and you're getting data from not just your own data, but the data of the whole entire system. Is that
Yes.
something
Yes,
that
it's
you're
super
finding useful?
helpful. Yeah, we just started that because, this job can be a little bit isolating. We're just in our own little islands and talking to patients all day, but sometimes having more brains is better for solving issues or getting ideas, getting a fresh approach to things. And so that's what that coaching call is. The whole team gets together and talks about anything new, talks about any new data, talks about new studies. And sometimes we'll have a patient, we're like, oh, what would you do with this guy? Because he's whatever, it's sometimes just nice to have a fresh approach and get some more input. Or maybe one coach will think of something that you weren't thinking of.
Yeah, I mean, it helps. It certainly helps that, and like itself helps us to generally improve the whole system. And we have something on the clinical side. There's the same thing that the physicians are meeting on a regular basis, saying, "Hey, how do you deal with this particular medical issue?" And so we are rapidly expanding our knowledge base.
Yes,
Because this is stuff that no one has ever really looked at before. It's just because it's always been drugs and procedures from the clinical side, and it's never been, hey, let's take a critical look at lifestyle metrics, how they work in real time with real patients, and start to see the patterns emerge and change the data.
that's just it.
Um,
And I think from the coach's perspective, we've got coaches from all kinds of backgrounds. So everybody's coming together with sort of their own area of expertise, if you will, at least their own set of experiences. And we can tap into all kinds of stuff. We've got one coach that had lots of experience with bariatric surgery, and another coach that's had functional medicine experience, and another coach that's really big into autoimmune. And so being able to pick all those brains is super helpful.
well, and I think I should point out that the coaches that we have on the Revero team draw from a huge number of applicants. We had, I think several thousand people apply. So we
Yes.
had the luxury of picking just some of the most, incredible folks to be part of our coaching program. So that's really, really wonderful to see. How much fun would you say you have with this? Is it, do you, I mean, are you getting enjoyment as a coach provider yourself?
Oh, best job ever. Best job ever. I mean, I could talk about this all day long. It's been my hobby really, but when I am now able to make it a way to make a living, I mean, I couldn't ask for anything more. In fact, I just applied for my nutrition medicine PhD to start that program. And my husband's like, are you nuts? But I could do this all day. I could just learn and read and talk to people all day about how to improve their health. It's been
Yeah,
amazing.
it's good that you're having fun. And I see the same thing on the clinical side. The physicians are like, look, this is my favorite. Because a lot of our physicians are working for us part-time, and then they have their traditional medicine job on the side, and they're like, I enjoy this way more, but the other stuff helps me to pay the mortgage and some of that stuff. And so as we, eventually as we grow and scale, hopefully we'll have more and more full-time folks that are able to do this full-time. Um, the Have you found which patients do you find are have the most struggle and are the most challenging maybe to bring to success?
I wouldn't qualify any patient type diagnosis wise, but the patients who come to us and are not open to suggestions. So that, we kind of, I think Francesca talked about this on your interview. We've got patients who are highly involved and high touch and want lots of involvement. And then we've got patients who are, you check in with them and no, I'm good. It's the no, I'm good patient that's usually takes a longer time to see results because they are kind of using their own way to do things and not allowing you in. And so sometimes it just takes a few more questions, a little bit of prodding to kind of pull them out and say, you had goals when you first started and I've got them written down here. Let's start making progress, even if it's just one thing at a time.
Do you have like I mean, some, as a physician, as a surgeon, I had things I like to do more than others. I mean, there was like certain fracture patterns. This is going to be real. I enjoyed more than others, and others like, this is going to be a real pain. Do you ever get any conditions or patients that you see that it's just like, I'm just going to have so much fun with this patient. It's going to be, I know it's going to be a good outcome. Do you have, what patients do you like to see, or do you have a favorite?
Oh, I don't know if I have a favorite, but I really like the quick results from diabetes, quick results from hypertension. It's super rewarding to be able to see the provider remove medications. And I always jump in chat after the provider says, okay, we're going to remove this medication. I'm like giving them cheers and celebration horns and everything. And that's super fun, especially when they're only 3 or 4 weeks in.
How often are you seeing medications come off the patients?
Just about every patient who's on a medication has some titration or removal.
Wow. That's
Pretty
powerful.
awesome. It's pretty
that's
awesome.
Pretty cool. Yeah. What about, so if anybody were like, what would you say to somebody who's on the fence and because a lot of people, as much as I've been on social media, it's Revero, I try to get as much information. There's a lot of people that have no idea what we do, no idea what it is. Mm-hmm. If somebody is maybe just sort of casually looked at the thing, what would you say to sort of say, hey, why this might be something you might want to pursue?
I always come from the angle of, if you want to get something different, you've got to do something different. So has what you're doing gotten you where you want to get? And if not, how about try this out? We even have a 4-month program, so you don't even have to commit to years and years of a healthcare team. Just give us a few months and try something different that you haven't tried yet. You've got 2 professionals on your care team and a whole bunch of brains on the other parts of the care team to make the most difference. And if you just implement a few little things here and there, how much further can you get that you may not have been able to do on your own?
Yeah, that's a great way to look at that. And, it's like, was it like Dr. Phil would say, oh, how's that been working for you, or something like that? He has a thing, how's that been working for you? It's just like, well, exactly. Yeah, it's not been working very good. So, yeah. And I think the other thing that's important is that this is really an unprecedented level of support that we provide. I mean, because, most people, unless they're like committed to an inpatient facility, which costs huge amounts of money, I mean, they don't get the daily support that we're able to provide. And I think, even the best intentioned physician just cannot provide this because they just don't have the resources. I can tell you there is millions and millions and millions of dollars in resources spent on getting someone to surgery or getting them on a drug program or, imaging them or getting them labs and all that stuff. But as far as actually providing nutritional and lifestyle related support, it's almost none.
Well, that's just it. And I'm glad you brought up support, because having your weekly community meetings as part of the Revero program has been super helpful for a lot of people. I've been on your calls where you've got like 80 people in there and they can get their questions answered. And often I see people come to this program with no support at all. So their spouse is not eating like they would like to eat. They haven't gotten their kids on board yet, or it's hard to be around their coworkers, or for whatever reason, they're very isolated in thinking this way and wanting to make these changes. And just having 2 people in their pocket on chat, cheering them on, and also being able to go to your community meeting I think that's made the biggest difference for a lot of people.
Yeah. And I think next week we're going to start a second one. So I've been doing it once a week. And so I'm going to offer 2, because we have that broad change in time zone. So we've got some people on the East Coast, and we were finishing at 9 p.m. for those guys, which I thought was, seems a little unfair. And so we're going to do something a little earlier. So
that's awesome. People love that.
Well, I'll tell you what, Christa, thank you so much for what you do and for being part of our team. I think you're a wonderful just asset that we have, and I think you're making a huge difference to people. And I'm glad you're having fun doing that, because that just makes it better. And that's the sense I get. Everybody who works at Revero is generally having a good time, because not that we're just hanging out and partying, but I mean, it's just that we're doing things that are making differences for people's lives, and it's really easy to see in real time. And I think it's rewarding. It's very rewarding. Anything else before we go, Christa?
No, I think we covered quite a bit, actually. Trying to think. Yeah, I just think giving the program a shot. Just taken a dive. And you can go month to month if you don't want to do the 4-month program. You can get some input from healthcare providers who do this every day to see if they are seeing something that you may not see. I mean, it's definitely worth it. And we are so reasonably priced, it would be a big miss to not give it a shot.
Yeah, I mean, because some people say they're cool about the price, and I'm just like, you are not going to get this level of support. You're not going to get a clinical team, physician, and labs anywhere else for the price that we're able to offer. And I think that is an important consideration. And you know, it's like for the cost of a cup of coffee at Starbucks a day for a few months, you literally change your life for the better, which I think is well worth it. But
100%.
Anyway, well, thank you so much, Christa. You have a wonderful day, and I'm sure we'll talk again in the very near future. It's exciting to see how things are progressing. It's been really fun. Thank you.
I appreciate it. Thanks so much, Shawn. See you soon.